Thank you for being here at the last afternoon. So I'm coming from Belgium also, but the south of Belgium. Here we have the Veterinary Teaching Hospital of Liège and the entry of our clinic where the study take part. And also we worked a lot with Belgian blue cattle, but not only, but most of the time. So I'm going to talk about digestive disorders and surgery digestive disorders. So digestive disorders represent 30% of referred cases at the clinic of the Veterinary Teaching Hospital. And we perform about 100 laparotomies per year. Cecal volvulus is the most frequent disease. Here you can see the cecum and the spiral colon with a bad ischemia. We have 39% of positive outcome, all ages and all diseases, all digestive diseases. And the average cost, it's between 300 and 500 euros. So we are working in cattle industry, and I think it's a great thing to know if we have tools to say if you have to treat or not the disease. So that is my question. I looked all those studies, and in dairy cattle we had studies about L-lactate as a prognostic factor for abomasum displacement and volvulus by Boulet and colleagues in 2014 and Sebastian Buzinski and colleagues in 2015. And also lactate is used in dogs with gastric dilatation volvulus and in horses with acute colitis. So L-lactate seems to be a reliable indicator of ischemia in obstructive pathology. As a reminder, L-lactate is produced in the cell, in all cells, in anaerobic conditions. So when we have a lack of oxygen in volvulus, for example, we don't have the opportunity to transform pyruvate. So we have a great production of L-lactate in the cell. So we performed preliminary studies in Liège, 2 studies between 2013 and 2017 with 166 animals with 19 calves. And we measure blood L-lactate at the arrival at the clinic, 12 hours and 48 hours post-surgery. They were all animals referred for surgical digestive disease. And we had some results for calves. So calves were aged less than 6 months, pre-ruminal calves. And blood lactate seems to be, before surgery, seems to be significantly different between bad and good outcome, but we didn't have a threshold, so it's not very significant. But in adult cattle, we had different results. So here we can see rock curves. Here the diagonal seems it's when the null test, so no difference between good and bad outcome. So we see lactate before surgery is no different. There's no difference between bad outcome and good outcome. But 48 hours post-surgery, we have a significant difference between cattle that will succeed, will have a good outcome, and cattle will die. We also looked lactate clearance, and we have a significant difference between good and bad outcomes when we watch the lactate clearance before surgery and 48 hours after surgery. So for adult cattle, blood lactate clearance time seems to be a better prognosis tool. We have values, so a positive outcome is predicted when the level of blood lactate is less than 1.94 millimol per liter at 48 hours after surgery, or when the decrease in blood L-lactate is superior at 70% 48 hours after surgery. But before surgery, we don't have any tools yet. L-lactate doesn't seem to be enough, and we have to combine it with another parameter. So we made a last study this year with 166 animals, calves and adults, referred also for surgical digestive disease in Liège, and we studied more parameters: age, weight, heart rate, blood lactate, base deficit, blood chlorure, and blood fibrinogen. And the question is, which one we have to combine with L-lactate to have a good prognosis, pre-surgical prognosis? We had good results, so we made a logistic regression, and 3 parameters have a p-value less than 0.05. So the age in groups, so we made different groups of age, the fibrinogen at the arrival, and L-lactate, blood L-lactate at the arrival. So we see here that we have a significant difference between the first group. So the first group is between birth and 1 month. So we have a difference between this first group and the group 14 and 28 months, and it's higher mortality rate in the first group. So calves before 1 month are dying more. And also in this group, so this group is 28 to 35 months. I think it's going to be studied, but it may represent the first calf, the first calving, and when heifers are calving for the first time, they have an immunity gap. So maybe, I don't know, it's going to be studied. Here we can see that fibrinogen, the more the fibrinogen is, the more the mortality rate is too. So we have, with a high fibrinogen, we have high mortality. And the same with the lactate. And all those parameters are before surgery. So we can now study for animals. Here we have one animal. If we have a calf between 0 and 1 month with 6 gram per liter of fibrinogen and 4 millimol per liter of lactate, we have a probability of death superior to 70%. We can see that it's not the same for calves between 14 and 28 months. It's very low here, so it's a better prognosis. And here we see that we are higher than this one for animals between 28 and 35 months. So blood fibrinogen, blood L-lactate, and the age of the cattle are reliable prognosis factors for surgical diseases before surgery. In conclusion, for all surgical digestive diseases, in post-surgery we can use blood L-lactate 48 hours after surgery. We have values and we can predict the good outcome of animals. But this is only in adult cattle. In pre-surgery, we found this year that with a combination of blood fibrinogen, blood L-lactate, and the age of the animal at the arrival at the clinic, we can also predict outcome. And that's for adult cattle and cows. Yeah. So now the research, the question are going to be why neonate calves are more likely to have a bad outcome, and why animals between 28 and 35 months are also likely to have a bad outcome. We are going to search, and we have the fibrinogen, who is really a good parameter. It's really statistically different between bad and good outcome, and we have to see if we can really eat with peritonitis maybe, and pre-surgery peritonitis. We don't know. So, thank you for your attention.